Top of the morning to you guys. Mike Galbraith, family and sports medicine physician, joined by a couple wonderful people today.
Brian Boehme, physiotherapist at Elite Sports Medicine.
Extraordinaire. And probably our biggest fan, I would say.
Probably one of the most.
Bernie. Bernie is in the background keeping us in check today. So, well, let's go over some shoulder stretches today. You know, a lot of people get tight with their shoulders or there's that muscle imbalance. So this is going to be kind of the simple, easy shoulder stretches. Then we'll do a different video for more advanced stretches.
Sounds good.
Let's start with a pendulum.
Okay.
So pendulum, you want to find like either a tall counter, maybe a tall table, and I like to kind of just hold on, just to brace myself with my good shoulder. And then let's say this is the injured shoulder. And so you'll kind of want to lean forward and you actually use your body to go back and forth. So I'm not just actively moving my arm, right? So you move your body, like, man, you get your hips into it.
Nice.
And you just kind of go back and forth like a pendulum. So I'll start with that. So let's see your pendulum technique.
Okay, so if I come just here, and this is just for support?
That's exactly right, yep.
Okay.
Don't go anywhere.
All right, and I just kind of rock back and forth.
Beauty. So I really like this, especially if someone's incredibly stiff or they just had surgery in their shoulder and they need to start just doing very simple mobilization. So this is just gravity. If we want to be a little more, just a touch more aggressive, we give Brian the lavender weight.
I can feel that.
So it just adds a little more traction, right? Now notice, you can also do some small little circles. So a little bit of circumduction or drawing, I always think drawing little circles, or you can do the back and forth. So I call that the circumduction or pendulum exercise. So very simple for a really, really stiff shoulder or post-op. And it gives you a chance to use some purple weights. Now let's do a counter stretch or counter slide.
Okay.
So
walk me through that.
This one, again, you want to find kind of a tall counter, tall table, and let's say here's the injured side that you put up here. And I always like to start with facing my hand, and then I kind of walk back. So this is like a dead fish right here. And then, and you just sit and hold like that.
Okay.
So we'll start that first of all. So you're facing your hand.
And just slowly step away?
Slowly step away. That almost makes me want to sing, but that's great. So you just hold that, and a nice good stretch out your shoulder. Again, you want to just a touch of stretch of discomfort. Great, and you hold it for a few seconds, come back up, and you can repeat it again, and you just hold it for 2 or 3 seconds. Nice, easy stretch. Good. You can even, again, as you kind of lean back, you add more of a stretch. Now, notice you're facing your hand. You can change this into different planes, too. You can start kind of facing turn like 90 degrees, and you can start kind of coming back away. Good technique.
Yep.
You're doing good.
Thank you.
So again, same type of thing, you're going to hold that. Now, you like to use different torture tools. Do you want to show us one of your beating stick stretches?
Oftentimes I'll find if you've got somebody with, say, an injured shoulder surgery, maybe even frozen shoulder, it's really difficult to lift it with their own strength because one, it's painful or so tight that it's difficult to get in range, any kind of range anyway. So those 2 exercises you just did are fantastic.
Thank you.
This is another one that I'll give to patients so they've got maybe a little bit of activation in their injured shoulder, their bad shoulder, but they've got some help with their good side.
Great, okay.
So this is just a broom handle, just an old one that I used to use all the time at my own house. It's really nice.
Got a lot of action.
But basically, I'll have a patient grab their, if this is my injured shoulder, the one that's got capsulitis or frozen shoulder, whatever it is, I'm basically going to have this hand gripping like this. And the reason why I grip it, and I'll always say to patients, thumbs up. Thumb up will help make sure that the joint has the best possibility to stay open.
Instead of
closed down, yes.
That rotates you in, right?
Yeah, so nice thing about this one is then I can use my good arm, my right arm, to help lift my bad one up. So I'm going to give it to you.
Perfect.
Good. So let's say it is your
I'll use
left
the same.
side. Yeah. So basically, if I can keep that arm straight, then I can just angle. If I wanted to have this arm go straight ahead, I just change that angle, and he's going to use this hand to help lift that one up. And I have had lots of patients find that they can have a better range, less pain with it, and just in general, it's just an easy one to do. And most people have a broom handle or a...
And this is doing most of the work.
Most of the work, yeah. Now, does that mean that one won't actively get those muscles to kick in? No, but it's got a lot of help. So you could do, and then you just did something I was going to say. So this one is just going straight up. You can change the angle and go out with it, kind of get into a little bit of an extension with that as well. Abduction, you could do different motions. The nice thing about it is that this is just meant to kind of come down and really just kind of come underneath and help it up.
Yeah.
As opposed to just kind of forcing it to the side, and then you're just going to make that left side have to engage a little bit more this way. It's just got a lot of help, and it's a simple way to get,
that's good stretch.
as I said, a good stretch with less irritation as you do it.
I almost feel like I'm ready to go into combat with this, like a samurai. All right, let's do one last wall climb.
Okay.
So, beautiful. I like that. That one's great using the stick.
Simple one.
So maybe I'll have Brian over to the brick torture wall. And so again, now you're going to start activating more muscles, so getting a little bit more advanced. So as he's facing the wall, he's going to slowly start climbing up the wall with his hand. The itsy bitsy spiders kind of climbing up the wall here, great. And then as he starts getting higher and higher, he can actually start pushing his almost armpit and shoulder in towards the wall. And that really adds more of a stretch going forward. And again, as you climb, you can hold that for a few seconds, and then you can start climbing back down. And of course, this is something you can repeat multiple times. Again, a little bit of discomfort's okay. And notice, if he needs to, he's assisting that arm coming down. The last thing I like to do is, I'll do this now kind of perpendicular, so Brian will face that direction. And now the arm is abducted, so it's away from the body, and he can slowly start climbing up the wall there. And same idea, nice, slow, controlled motion. And eventually, as he gets higher and higher, he can kind of start leaning in to the wall. And then once you get to the top, if you're able to get that high, then you can really start to kind of just hold that for a few seconds, then you work your way down. And so that's the wall climb facing the wall, then the wall climb to the side, and again, works on some great motion. So that's great, Brian.
It felt good. That felt really good.
We talked about the pendulum. We talked about the counter stretch. We did your samurai assisted one. Motion. And then we talked about the wall climb, and my shoulder feels really loose right now.
It should.
It feels amazing. So those are some 4 real simple exercises to start with your motion. We'll give you some more advanced ones in just a minute. Thanks, guys.